If your feet look like this, your liver may already be in serious trouble. Most people never connect what is happening at the bottom of their body to what is happening deep inside one of their most vital organs. The liver is silent by nature. It has no nerve endings capable of producing pain in the way a pulled muscle or injured joint does. So when it is struggling, when it is inflamed, congested, or beginning to fail, it communicates its distress through symptoms that appear far from where the damage is actually occurring. Your feet are one of the most revealing places your body sends those signals. And learning to recognize them could be the difference between catching a serious liver condition early, when it is still highly treatable, and discovering it far too late. This is not about creating fear. This is about giving you the knowledge to listen to your body with the intelligence it deserves. Sign 1. Swelling and puffiness that does not resolve. One of the earliest and most commonly overlooked signs of liver dysfunction is persistent swelling in the feet and ankles, a condition clinically known as peripheral edema. Here is the direct biological connection. Your liver is responsible for producing albumin, a critical protein that maintains the osmotic pressure, keeping fluid inside your blood vessels rather than leaking into surrounding tissues. When liver function is compromised, albumin production drops. Without sufficient albumin, fluid escapes the bloodstream and accumulates in the lower extremities, pulled downward by gravity. The result is swelling, puffiness, and a heaviness in the feet and ankles that does not resolve with rest or elevation the way ordinary fluid retention does. If you press your finger firmly into the swollen area and the indentation remains for several seconds after you release, this is called pitting edema, and it warrants immediate medical attention. It is a sign that the liver's protein production has been significantly compromised, and that fluid regulation throughout the body has been disrupted at a systemic level. Sign 2. Yellowing of the skin or nails. Jaundice, the yellowing of the skin, eyes, and in some cases the nail beds and soles of the feet, is one of the most direct and unmistakable signals of liver distress. It occurs when the liver is unable to adequately process bilirubin, a yellow pigment produced from the normal breakdown of red blood cells. In a healthy liver, bilirubin is processed and excreted through bile. When the liver is damaged or overwhelmed, bilirubin accumulates in the bloodstream and begins to deposit in the skin and other tissues, producing the characteristic yellow discoloration. Subtle yellowing of the soles of the feet or the skin around the toenails is sometimes the first place this discoloration becomes visible, particularly in individuals with darker skin tones, where it may not be immediately apparent in the face or eyes. Do not dismiss a yellowish tint in these areas as a cosmetic issue or a reaction to footwear. It is a biological signal that deserves urgent clinical investigation. Sign 3. Itching with no visible rash. Persistent itching on the feet and lower legs, particularly when there is no visible rash, no allergic trigger, and no response to topical treatments, is a symptom that many people suffer through for months or even years without ever connecting it to their liver. When liver function is impaired, bile salts that would normally be processed and excreted can accumulate in the bloodstream and deposit beneath the skin, producing an intense, often relentless itch that is particularly prevalent in the extremities. This condition is known as cholestatic pruritus, and it is one of the more diagnostically significant symptoms of liver disease because it so rarely has another adequate explanation. Your feet are speaking on its behalf. Persistent swelling that does not resolve. Yellowing of the skin or nails. Unexplained itching with no visible cause. Changes in toenail structure and color. Unusual vascular patterns on the skin's surface. None of these symptoms should be normalized, dismissed, or attributed to aging without proper medical investigation. Liver disease caught in its early stages is overwhelmingly manageable. Liver disease discovered late carries consequences that are far more difficult to reverse. Look down. Pay attention. And if something does not look or feel right, do not wait. Your body has been trying to tell you something. It is time to listen. Sonnet 4.6 Claude is AI and can make